Hello everyone, it's Andrea Tooley from AndreaTooley.com, and I am here for the video that you've all been requesting forever. I have Dr. Mayo Babu, who is a neurosurgeon here at Mayo Clinic. She's a neurosurgery resident, and she's going to tell us all about neurosurgery. She is a force and is just involved in everything, and is one of those people that I know is going to make you all want to work harder, do more. She's just incredible, so I'm so happy that you're here. Thank you so much for being here.
Well, thank you for having me. I'm really excited.
It's going to be great. So can you just start off and tell us who you are, where you come from, kind of a little intro about you?
Sure. So I grew up outside of St. Paul in Egan and wanted to do something in medicine ever since I was young. Didn't know what. Really enjoyed neurology, psychiatry. Thought I would do something either neurology or psychiatry. And I actually really liked law, too. So for a while, I thought I'd be a lawyer.
Interesting.
But then I became ill when I was in college, a second year.
Oh.
I had this rare illness. Thankfully, I did okay and I'm in remission and everything.
Wow.
But that really made me think I should go into medicine. So
Wow.
went to medical school. And yeah, just loved the neurosciences. So that's what made me land in neurosurgery.
Fantastic. So you went to Harvard Medical School, and before you went to medical school, you majored in neuroscience. Is that correct?
That's right. Neuroscience and psychology. That's right.
Okay. And so what made you decide to go into neurosurgery when you were in medical school? How did you make that decision?
Yeah, so it's funny because when I started, my first 2 years, I thought I was going to do neurology.
Okay.
And all my advisors said, you should do neurology, it's better work-life balance, all of that. And it wasn't until I started my third-year rotations, my first rotation was surgery.
Okay.
And we got to spend a week doing an elective, so I chose neurosurgery. And so the second-year neurosurgery resident at the time was a really great mentor.
Okay.
And he, I got to see him have difficult conversations with patients and their families, and operate in the middle of the night and take care of people, and it really made me go, this is really neat and something I want to learn more about. And so I talked to him at the end of that week, and I said, I'm interested, but I'm not so sure this is for me. And he was like, what are you talking about? Of course this is for you. And it just so happened, I'm really interested in health policy, and it just so happened he was very interested in health policy and health economics. So he was my research mentor from there on out, and so really kind of showed me that you could be in a surgical subspecialty, but you could also have other interests in policies. So that's what made me just fall in love with the specialty.
Okay. Well, I want to talk more about your involvement in policy and the American Medical Association, but let's just kind of back up for a second, if you don't mind, and give us an overview of neurosurgery. What is the career? What can you do as a neurosurgeon? I feel like it's one of those professions that's so glamorized, and everybody wants to be a brain surgeon, and it's definitely one of my most requested YouTube videos. Everyone wants to hear from a neurosurgeon. So just tell us about the profession and what you do.
Yeah, so I would say it's not for everyone.
Sure.
And not just in terms of the lifestyle and the rigors of the lifestyle, but you really have to enjoy it. If you're in a surgery all day, and you know this in your career too, unless you really love what you do, it's just not going to bring meaning to you, and you're not going to take good care of your patients. So, neurosurgery is a very diverse specialty. There's about 14 subspecialties within neurosurgery.
14?
So, yeah, we have vascular, so you treat aneurysms, spine. You can have deformity spines. You treat, adolescents with scoliosis, for instance. We have tumors, so we treat brain tumors, spine tumors, radiosurgery. So we are involved with radiation therapy for brain tumors and spine tumors as well. And so it's a very diverse specialty. We have pediatric neurosurgery. We treat adults, obviously. You really get to see all ages, all types of pathology. And what's neat is you get to interact with all different fields. So, for instance, we treat pituitary tumors. We do transsphenoidal surgeries through the nose. And we get to work with endocrinologists. You get to work with ophthalmologists.
Yeah,
if there's visual problems.
Yeah, lots of times.
We get to work with oncologists. So you really get to work with other specialties, too. So it's a really neat field.
Okay. Yeah. That's great kind of overview. And tell us about what being a neurosurgery resident is like. because everyone hears about how daunting it is, and it's the hardest of all the residencies. And what's it like? You're done, basically. Is that right?
One more year.
One more year.
Yes,
so
close.
You've been through it. So how many years is it? What's it like being a resident, and what is residency like?
Sure. It's a 7-year program.
7 years.
Yeah. And most folks subspecialize, so do at least 1 or 2 years of fellowship afterwards. That is, if you're interested in a career in academics. If you're going into private practice, you don't have to do a fellowship per se. But residency, I think, anywhere you go is long. You know, I think the quote is the days are long, but the years are short.
Yes.
And again, I think it's if you love what you do, if you enjoy the surgeries, if you enjoy the working with patients and the types of conditions you see and treat, the time really flies. But it is something that you really have to love, especially when you're getting up early in the morning and it's a cold winter day and you're just trying to drag yourself to work. I think having that ability to remember who you're caring for and that your patients are worse off than you are and they need you is really important. But I think it really comes down to whether you like it or not. And I think you find that out probably your 3rd year of medical school, I think was the most informative for me at least. But
okay. What is a day in the life of a neurosurgery resident like for you? I'm sure it varies between what rotation you're on, but just kind of an overview.
Yeah, so I would say probably one of our, covering one of our busier services. Yeah. We start... we should be in the hospital by about 5:30 or so. I would say no later, 5:30, 5:15, maybe a little later, 5:45, depending on how many patients we have inside the house. And we usually like to make rounds before 7, be done with our rounds, be done with paperwork, any progress notes. We usually communicate with our consultants or attendings either via email or we page them in the morning just to touch base about any issues from overnight. 7 to 8, we have educational conference, and that varies from program in terms of when they do their conferences, but we typically do that every day of the week, 7 to 8 o'clock.
Okay.
And then 8 o'clock we get ready for the OR. So we have to be down in the operating rooms, make sure the patients are there, positioned, and all that. So. And then depending on your case or cases for the day, you may wrap up, probably I would say at the earliest around, 4 or 5. If it's a late day, you might be there, past 10, depending on how long the case is or if there's, any issues or it was technically difficult or anything like that.
Sure.
But yeah, for the most part, I would say most of the, there's some surgeries that can be very quick. Most of the surgeries take a couple hours, 3 to 4 hours, I'd say, on the average.
Okay.
There's longer surgeries that can last 12 hours, and sometimes there's very complex, skull-based tumors that can last 14, 16 hours, but you're typically working with another service.
Right.
And can, have a break.
Step out when they do their part and things like that.
Exactly.
Wow.
So, yeah.
Okay. So those are long days and hard work. Yeah. But worth it, like you've said. That's such a great attitude. And what do you think is the best advice you have for people interested in applying to neurosurgery? Yes. So you apply just like any other residency program, but it's very competitive. What would you say to those interested in neurosurg?
Yeah, I would say spend some time shadowing, but really doing a sub-internship when you can.
Okay. And
rotating and seeing what residents do, what attendings do in clinic. And the reason I say that is when I started medical school, I remember there were 4 folks who started with me and who were gung-ho neurosurgery. I mean, you could not shake that. And first and second year of medical school, they were just gung-ho neurosurgery. Yeah. And it's funny because all 4 of them ended up matching in something completely different.
Wow.
And there were 7 folks my year who matched into neurosurgery, and all 7 of us started thinking
something
we would
different.
do something different.
Yeah.
Exactly. So I think it's really important to keep an open mind because I think, you have a perception of what you think a specialty is, and then you see it, and obviously it varies, whatever your rotation might be as a medical student is not reflective of how a field is, throughout the country. But it gives you a glimpse of maybe the best or the worst case scenario, depending on your experience. And if you like it still, I think that says a lot. And so I would say, certainly don't discount any specialty. I think go through your 3rd year of medical school with an open mind.
Yes,
and
definitely.
And ask people around you what made you the happiest. because I think you can tell, when you come home and you're just a happier person, you may not have that insight, but the folks around you will say, gosh, you really just were a delight to be around. And
I love that. That's such good advice.
Oh, thank you.
When was I the happiest? When I came home. Because it's true. When you enjoy it, you go home and you're on this high. And, this is what I did today, and I want to tell you all about it. And it's true.
Exactly.
Yeah.
So, but don't feel like you need to, I will also say, conform to some ideal that you think exists. Because I think the worst thing is to be miserable. Certainly for 7 years, but most often you'll be miserable for a year or two, and then you'll realize you want to switch specialties, and you don't want to have to go through the match again and do all that.
Right.
So just try to pick something you love.
Yeah, make sure it's what you want to do.
Yeah.
And then obviously research, good board scores. What about away rotations, those kinds of things?
Absolutely. Neurosurgery as a field very much looks at research.
Research, okay.
And don't worry about the number of publications necessarily. I think
quality.
A lot of folks, exactly. The quality, also the type of project you work on. If you're doing a basic science project, I think folks have an understanding that that's going to take longer to get data. And I think it's also your mentors and who can write you a letter and say, this person came up with this project versus this person just latched onto something I've been doing in my lab for years and years.
Right.
So trying to be a self-starter is important.
Yep.
Obviously do well in your clinical rotations, do on your boards, and away rotations are important. I do think you should do at least 3 to 4 away rotations.
Wow,
in
3 or 4 aways.
I think so.
That's a lot.
I think so because one, it helps you. You get to see different practice types, different locations. But I think also because it's a competitive specialty, you want to get your name out, and there's a lot of issues if you're matching as a program. If you're matching 1 or 2 residents, you want to make sure that your rank list really reflects what you want in your program, and it is a match after all. And so I think that if you're in one part of the country, there often is a perception, well, this person isn't going to come back to this part of the country, or vice versa.
Yeah.
So I think if you're really interested in a region of the country, if you're interested in a type of program, an Uber, research institution, definitely do an away rotation there, or a similar caliber institution, so you get that experience, and then too whether that's something for you, and then they know that you're serious too about that.
Really good advice about aways. Excellent. So you work really hard in medical school, you do all this research, you match into neurosurgery, you've given us this fantastic overview of what residency is like. Are the hours similar for attendings, or once you're out of fellowship, are you still working that hard? Because people want to know, can I have a family? Can I have work-life balance? How do I manage this as a neurosurgeon? Is it possible?
Yeah, I think that's a great question. I think it's very dependent on where you end up.
Sure. Yes.
So academic places, I think it's very doable, but you have to be realistic. If you're in an academic center that is very research heavy, that values you based upon the number of NIH grants you have, or whether you have a lab, it's gonna be a struggle to have a good work-life balance, and I think that's true of any field. If you're not as concerned about climbing the tenure track, and you're happy with just having a good clinical practice, I think you can make work-life balance work very very easily. I think Mayo in particular is an outstanding institution for work-life balance. In the private sector, it also varies. Some private practices, the group sort of has this understanding. They work hard, but they perhaps don't make as much revenue as other private practices, where it's just, an eat what you kill model. You're just working, and you get whatever revenue you generate based upon how many surgeries you do and how many patients you see. Right. And in that type of a model, too, I think work-life balance is a challenge. So bottom line is, as long as you're comfortable with maybe not making as much in terms of income, or maybe not having as much prestige, I think you can very easily have a good work-life balance, but you have to be comfortable letting go certain things that, because not everything will balance.
Right, you can't have everything, so you have to make those decisions.
But definitely, I would say look around. There's always, ways to make things work. The other thing, too, to think about is locums. Sometimes you'll have folks do locums where they're, they work for a stretch of time. They either work, weekends, they cover weekend call, or they'll work a week or two at an institution and then be off for a week or two.
Oh, that's so nice.
And so, and obviously you don't have a set schedule every day, you don't have a set institution.
Right.
But the benefit is you work for a stretch of time and then you're home, maybe you spend time with your kids, or you have, other commitments that you have. But there's ways to make it work.
Okay. That's really good. Great explanation of how to achieve that work-life balance and be realistic about what you want, and know that, maybe if you desire this extremely academic career, like you said, where you're on the tenure track, it's going to be harder and you'll have to sacrifice different things. But I really like what you said, too, about looking at mentors and finding people. I always wanted to find people who had the job that I wanted. And so if you find someone who's doing what you want to do, or you can see how they make it work in their life, then you know that you can make it work for you as well. And so when you're doing your aways, look at how the attendings and consultants there are working, things like that.
Absolutely.
Okay.
Yeah, and I'll say, too, when you're doing your aways and interviewing, see how the residents interact.
Yes.
I think that's really informative, because you'll hear from a lot of programs, we get along, everything's great, and then you see that the residents don't talk to one another at dinner or what have you, and then you're like, not sure I'd fit in here.
Interesting.
So I think you see a lot if you really take a look at how residents interact with one another.
Okay. That's such a good overview of the residency, what people can expect. I hope this is going to answer all of your questions, because it answered tons of mine. I don't know anything about neurosurgery. It's this kind of secret world, and it has these golden gates. It seems so very unreachable and just mysterious. So if I feel that way, then I know that everybody watching feels that way. I want to kind of segue into some of the really unique and just outstanding things that you've been doing. Can you tell us about your involvement with the AMA? And she's like a big deal, and it's true. And so I'd love to know how you got involved and what kind of things you do, and just what makes you so special.
So I serve on the board of trustees of the American Medical Association. There's a resident seat on the board, and it's an elected position. So I went through an election, had to raise money and $10,000 and all this stuff.
$10,000.
Yeah, it was like an election, So, but I went through it. It was a very good educational experience.
Yeah.
But I also serve on the Board of Regents for the American College of Surgeons. I serve as the chair of the Resident and Associate Society. And
Fantastic.
I think it's really important to be involved in organized medicine. I think, what's been really helpful to me being involved with the College of Surgeons, but then also the AMA, is you learn so much, not only about different specialties and what other fields kind of face, but you also learn about issues that you are not aware of. So educational issues. I mean, there's many educational issues with residency review committees, duty hours, all the milestones that residents are being held to, and you don't necessarily understand the gravity of what you're being held, what standards you're being held to, and what you're being held accountable for until you're part of larger organizations that are involved in creating these standards, or give you a voice to try to leverage change and fix some of the problems that you see with these standards. So I think it's really, I view it not just as a responsibility to get involved, but I think it's a great outlet, because once you, even as a medical student, you see a lot of issues when you're doing your rotations, ways systems can be improved, patients can have their care improved, and certainly when you're a resident, you see many ways that the system can be improved, and having that opportunity and that outlet to join with other trainees from across the country and share similar experiences and try to come up with a solution, I think is really important. So I've found that experience really valuable.
Wonderful. And I'm sure very rewarding, too.
Rewarding, yeah.
Because you can see the direct implications that it has in your life and the effects that it could have in your life right now.
Absolutely.
It's just outstanding. Well, Dr. Babu, you've given us so many amazing tips, and I really think that people are going to appreciate this so much. Any other pieces of advice or words of wisdom to everyone out there who's studying for the MCAT or working on their ACT and their SAT scores to get into college, or studying for Step 1, or all of these things, hoping that they're in your shoes one day? What kind of advice do you have?
I would just say, work hard.
Yep.
I think that things work out,
Mm-hmm.
for a reason, and it's very stressful, and I don't, wish to go back to those days, but eventually it'll all pay off, and
Yes.
you'll be happy, and you'll find a career that's right for you. But I think you're doing the right thing, trying to prepare and learn, and I would just say keep an open mind. You never know what'll make you really happy.
That's so great. Thank you so much.
Thank you.
All right, everyone, I hope you enjoyed this video. Click subscribe so that you never miss another video, and we'll talk to you soon. Bye.